Okay, everyone. So Unit 5 is Law, Ethics, and Policy in Public Health, or just kind of health law, ethics, and policy. So we're going to start with law because I think that's the one about which there's the least amount of background knowledge and the most confusion. And I wasn't super happy with how the textbook did it. It wasn't horrible, but I want to give you some concrete examples today that hopefully will be helpful. Let's be clear, when we're talking about law for the purposes of this lecture and this course, what we're talking about is a rule for behavior that is put forth by a branch of your government. And violation of that law can result in some type of penalty. So fines, imprisonment, other sanctions, right? So this is something that the government has decreed and that the government will enforce. So in the United States, there are four basic types of law: constitutional, legislative, administrative, and judicial. And I didn't even realize that until relatively late in my life. And or more recently, I guess I'm not late in life yet, and it was the source of much confusion. So hopefully this will give you a little primer and you will not become as confused as I did in my life. We'll talk about constitutional law first. So this refers to the founding documents of that government, so of that country, of that state. And so we, as residents of Wisconsin, are also citizens of the United States. And so, of course, we, the people of the United States, in order to form a more perfect union, right, the whole preamble to the Constitution, that's our federal Constitution. And what the federal Constitution does, for the most part, is just sets up how our government is going to operate. So it is the Constitution that says, okay, we're going to have a legislative branch with the Congress, and that's going to be composed of Senate and representatives. We're going to have the executive branch, which is the president and federal agencies, and then we're going to have the judicial branch, which is a system of courts and the Supreme Court. That's basically all the Constitution said. It didn't, and there were lots of rules about how this was all going to work. It doesn't say anything particularly about health. But of course, over the years, they realized some things were missing from the Constitution, and so they added amendments to the Constitution. The first 10 are we talk about as the Bill of Rights. And so they give you, freedom of religion, right to peaceable assembly, things with which we're very familiar and people are often quoting, right? But the Constitution in itself didn't really say anything about health, and that statement about life, liberty, and pursuit of happiness is actually from Thomas Jefferson's Declaration of Independence. And that was kind of added sort of to the Constitution in the 14th Amendment, which is going to make an appearance later in this lecture, in 1868. So we didn't have anything about life, liberty, and the pursuit of happiness in our foundational government documents in terms of our Constitution or what people were guaranteed until 1868, which is pretty late when you think about, 1776, right? So one thing that the Constitution does provide for is it allows for states to take actions to protect the common good and the common welfare. That's referred to as police power. So police power, you might think, oh, that means that you can be arrested. That's just a part of it, right? There are other things that states can do in order to protect the common good. For example, when I lived in New York, for a long time there was a law against selling alcohol on a Sunday, right? And that was something that the state enforced because they thought it protected the common good, and they're allowed to do that because the Constitution says states can do that. And it was really tricky one year when it was New Year's Eve on a Sunday and I put off buying the champagne. And so we had, sparkling grape juice instead, which is fine. But what's also interesting about the Constitution is, though, it says states can do things and they do have power over their citizens in order to protect the common good. They are not required to do any of those things for the common good. So that's kind of interesting when you think about the precedent set by law. So as I mentioned, right, it protects freedom of speech, religion, peaceable assembly, right to bear arms, right? All those things are in the amendments to the Constitution. And also there are what are called inferred rights. So there are things that in the Constitution they don't say specifically. So in the 14th Amendment, for example, they say that the federal government, the government can't do anything to deprive you of your rights to life, liberty, and pursuit of happiness. Now, what does that actually mean in practice? So the interpretation of this law, which is done by judges, so the judicial system, has inferred several things over the years from that particular amendment. That you have the right to privacy, that the government doesn't really have any business knowing your business unless they have a demonstrated need. Your bodily integrity. So, for example, let's say a relative of mine has kidney failure, they need a kidney transplant or they're going to die. And let's say I'm a complete match, I'm a perfect match, I could be a donor. You cannot force me in the United States to donate my kidney, right? I have bodily autonomy, you cannot force me, right? And so that becomes really interesting when we talk about some public health measures, including vaccination mandates and all those types of things. Procreation, so there's some inferred rights that I have the ability and the right to decide whether or not and when and how I'm going to bear children. And travel, so your ability to move around freely, have been things that the court has said, well, I think what they meant was you should be able to do these things. So that's the federal constitution. We also have state constitutions, and they vary from state to state in terms of what they say, and we don't have time to go into that, but just know that you have more than one constitution that applies to you as a citizen because you're a citizen of our country and of a particular state. What's important to know about any state law, whether it be constitutional or otherwise, is that it can always be superseded or overridden by the federal law. So anytime there's a conflict between what a state law says and what a federal law says, the federal law takes priority. It always overrides it. Okay, our second type of law is legislative statutes. They're laws. They're just called statutes. I don't know why. Okay, so legislative statutes are laws that are passed by the legislature. So the legislature at the federal level for our whole country is the United States Congress, which is composed of the Senate and House of Representatives. We also have a Wisconsin state legislature, which is composed of a Senate and an Assembly. So you have, as a person who is a resident of Wisconsin, you have state senators, right, Tammy Baldwin and Ron Johnson, and you have that go to U.S. Congress. You also have representatives in the House of Representatives that represent you at the national level. But you also have a senator for the state legislature and assembly persons for the state legislature, which you may not have been aware of, but those people actually have a lot of power over how things work in your state. So anyway, so these legislative bodies at both the state and the federal level can pass laws that have pretty big impacts on our lives and public health policy. So, for example, just a smattering of some important laws over time. So in 1935, the Social Security Act was passed. Before then, people, if they had not saved up for retirement, would often be penniless in old age. And there were, grandmothers living on the street, right, if they didn't have family members who could take them, and it was horrible. Then in 1944, the Public Health Service Act, which then laid the foundations for the creations of things like the National Institutes of Health, the Center for Disease Control and Prevention, the CDC, right? And the fact that the federal government had an interest and a role to play in the health of the nation. Clean Air Act in 1963, huge in terms of reducing air pollution. 1965, some laws were passed that established the creation of Medicaid and Medicare. So Medicaid is a system of subsidized health insurance for people who are indigent or poor, and Medicare is a system of subsidized health insurance for people who are over age 65. Generally, they keep changing the rules, but 65 in general is when you're Medicare eligible. The National Environmental Policy Act in 1969 ended up then resulting in the creation of the Environmental Protection Agency, which has had huge impacts on our health. 1971, Occupational Health and Safety Act, which then led to the formation of the Occupational Health and Safety Administration, or OSHA, which regulates workplace conditions to make sure that they are safe and not hazardous as much as is possible, right? If you're a firefighter, there are inherent risks, but your employer has to take all reasonable precautions to keep you as safe as possible. 1996, the Health Insurance Privacy and Portability Act, which does not mean that people can't ask you health information ever. It just means that your healthcare provider, your physician's office, cannot share health information about you without your permission unless it is necessary for your medical care. Like if I refer you to a surgeon for a consult, I can send that surgeon information about why I'm sending you to them. Sorry. Goodness, that was exciting. Sorry. And then in 2010, the Affordable Care Act, which we're going to talk about at length. So lots of laws that impact public health and healthcare. So one other example that I didn't yet talk about was Emtala in 1986. So the background and the reason why this law came into being is that in the mid-80s, people in Chicago started realizing that some of the hospitals would deny service to people who showed up to the emergency room because they didn't have health insurance and they were poor. And the hospital was like, you're not going to be able to pay the bill, so sorry, you can't come in. And so this was called patient dumping. They were often transferred to another hospital, and sometimes they were really unstable and like in the middle of having a heart attack, and then they got sent across town to another hospital, and there were really poor outcomes, and it wasn't fair to the hospitals that these people were going to. And so it was a big problem that people couldn't get emergency care if they didn't have the ability to pay. So a law was passed in 1986 that if you have a medical emergency or you're in labor, and so you might have read in the textbook how there was a case where there was a woman in labor and a physician refused to take care of her and her infant. He said, no, I'm not going to deliver your baby. And the baby ended up dying, right? And but there was no legal, at that time, there was no law that said he had a requirement to provide care, right? Which is pretty amazing. But so now if you have a medical emergency or you're in labor and you show up to an emergency room, they must give you at least a medical screening examination and stabilize anything that's going on with you. So anything that's immediately threatening to life, limb, or organ function, they have to take care of it. And they can't just kick you out onto the street, whether or not you have the ability to pay. So this means several things. One is it means that if you go to an emergency room for something, you will get seen, regardless of ability to pay. And so for a lot of people in our country historically who have not had health insurance or have not had the ability to pay their bills, they would go to the emergency room for everything, right? So they would go to the emergency room because they had a wart on their hand, or they would go to the emergency room because they've been having headaches for 4 months, and it's not particularly bad today, but why are they having these headaches, and could you perhaps prescribe some medication? Which is not ideal medical care, but during a time when people didn't have access to medical care, to routine primary care because of inability to pay, it was better than nothing. But as you can imagine, it's not really appropriate use of emergency rooms, and the emergency rooms that are taking care of these patients are often not getting paid because these are often people who don't have the ability to pay. And so it's estimated in our country right now that about half of all emergency care services go uncompensated. So those ER bills, those urgent care bills, they never get paid, right? And which is one of the reasons why healthcare is so expensive for those of us who are paying bills, right? We're subsidizing the care for people who don't pay because they're unable to, right? So we'll talk about that again later. So that's Emtala. Another example of a legislative statute is, of course, the Affordable Care Act, or the ACA, which was also called Obamacare, which is really interesting because this was passed by Congress, right? So yes, President Obama at the time did a lot of publicity about it and worked with experts to come up with some recommendations and things that he thought should be included, right? So one of the things that the president of our country can do is help bring attention to things and kind of set what their priorities are. And but it's Congress who passes them, right? And so this was passed in 2010 by both houses of Congress. There are tons of provisions in it. It's like 900 pages long, but some really important things that I want to make sure you know about that are in the Affordable Care Act are, one is that it expanded access to health insurance. Remember I was talking about, oh, people didn't have any health insurance, they would just go to the emergency rooms. That was no good. So it created health insurance exchanges, so healthcare.gov, and a lot of people who have not had access to health insurance through their employers, through their jobs, now have had access to low cost or sometimes no cost insurance through the healthcare exchanges. I know for many friends of mine, for example, who are artists or writers, or they freelance work, this has been a godsend because they could never get any decent health insurance before, and now they can. It also expanded funding for the Medicaid programs, and this was a voluntary thing, so some states agreed to take the extra funding and some states didn't, such as Wisconsin, which is very interesting. You can also stay on your parents' insurance until age 26. So this has had a huge impact on young adults' ability to access healthcare. It used to be you could only stay on your parents' insurance after age 18 if you were a full-time college student. And even then it was only up until, I think, age 21 or 22, and then you got kicked off, right? So this kind of acknowledges that it can take you a while to get on your feet and get a job that might offer you health insurance. So that was a huge thing. It also said there can't be any caps on benefits. So it used to be that a health insurance plan would say, well, we'll pay for hospitalizations up to $100,000 per year, or something like that. So there were annual caps or lifetime caps. It said you can't do that, right? It's not somebody's fault if their medical bill went over $100,000 because they were in a super bad accident or had a really bad cancer. It also says you can't be denied insurance because you're somebody with a history of cancer. And so I actually had a colleague when I was in my medical training, and he had had cancer as a child. He'd had leukemia, and nobody would give him health insurance. And so it was awful. He couldn't get health insurance, or if he could, it would cost like $20,000 a month. It was ridiculous. But Affordable Care Act says you can't do that. It also says you can't kick somebody off of their health insurance if they're proving to be an expensive patient, which also used to happen. Affordable Care Act also says that preventative care has to be covered. So routine recommended vaccinations, physical exams for kids like well-child checks, mammograms, other types of cancer screening, birth control, right, or contraception has to be covered without cost sharing because these are things that help protect the health of people and prevent illness. So we wanted to make sure those were all covered. There's a section there that says you cannot be discriminated against in healthcare based on your age, sex, gender, religion, sexual orientation, or gender expression. The controversial part seems to be like, well, gosh, all this sounds really good and like it makes common sense. And why are people like, oh, Obamacare, right? Why were people so upset about it? Well, the thing that people were upset about was the individual mandate, which means you have to have health insurance, right? It is required as part of the law that you have health insurance through it could be through your parents, it could be through your work, it could be through the exchanges, it could be through Medicaid, but you have to have health insurance. Right? And so people who are fans of individual liberty would say, well, you, the government, can't tell me that I have to do it. I want to not have to do it. And so people were really upset about that. Again, that tension between individual rights and liberty and kind of the good of the community. Now you might be saying to me, well, why is me having health insurance a good for the community? And the answer to that is that it has to do with how insurance works. So if only the really sick people buy insurance, then the insurance companies are going to go out of business. Because what you need to have is you need to have a balanced risk profile. So health insurance companies are able to be as profitable as they are because they have a lot of people who are paying for health insurance who don't end up racking up a lot of medical bills that then the insurance company has to pay. So that helps offset the costs of the people who actually are getting more medical care, dollars worth, than what they were paying for the insurance. That's how insurance works for everything, right? Whether it's car insurance, house insurance, all those things. So this was controversial though, but because people didn't want to be told what to do, but it was necessary in order to be able to expand that coverage. We had to make sure that it didn't end up driving the health insurance companies out of business. Okay. So the Affordable Care Act got a lot of bad press initially, and so it was pretty unpopular. But over the years, as people have had it in effect in their lives and have seen it made real positive differences in their life, we can see now more Americans support the Affordable Care Act at 42% than think that it was a bad idea, which is now down to 35%. So sometimes we think things sound terrible and then we're like, oh, actually, this is working out pretty well. All right. So why did we pass this law, right? What was the problem? Well, the problem was medical care is really expensive. And so I don't know if you can tell, this image is kind of small here, but causes of personal bankruptcy, right? 2/3 of people who declared bankruptcy said medical costs were a factor. And when you ask what the biggest factor was, far and away, right, medical expenses, far and away the biggest cost, the biggest cause of bankruptcy, right? So people are going bankrupt because they got cancer or because they had a heart attack, right? And people were like, this is just not acceptable. And so remember when we were talking about establishing etiology way back and the conditions that needed to be met? And one was that we need to see an association, right, with people who declare bankruptcy are more likely to have medical expenses. And one of the requirements is that the cause had to precede the effect. Right? So this is a nice little study that I'm showing you a snippet here where they looked at people who got hospitalized and they looked at the rate of bankruptcies before hospitalization in this large group of people and after hospitalization in this large group of people. And we can see a couple of things here. And I can't see my cursor. There it is. All right. So we can see this line here is when they were hospitalized. This is time 0. And you can see this massive increase in the rate of bankruptcies after hospitalization. Now, people were getting more bankrupt over time just as it goes, right? But if that line had continued, they might have ended up down here. So it was a big problem, and that's one of the reasons why the Affordable Care Act was passed. Did it work, right? So we need to evaluate the effectiveness of any intervention. And so what we're seeing here is percentage of US adults who don't have health insurance. So did it effectively get people on health insurance? And what we can see is yes, in fact. So from before the Affordable Care Act to several years, it took several years to implement it. So we don't see the effect of it until kind of into 2014, but we can see that the rate of uninsured Americans now is down around 11%, used to be up around 15%. So that's good. And what we can see too is that historically and still, younger people are more likely to be uninsured. Makes sense. They're less likely to have health problems and to understand the importance of health insurance. So we can see here that, the number of people who are uninsured, right? And so let's see. So 19 to 25, right? So young adults, that's the blue line here, used to be 30% of young adults were uninsured, right? So if you got in a car accident or something, you'd go bankrupt. It's now down to about 14%. So we have made strides, right, in getting people on health insurance. So that's really good. So did that then help decrease bankruptcies? Yes. So this is really cool. So this looks at, this is a study of the percentage of families who report trouble with medical bills. This is actually numbers. And so it was around 55 million in 2011. American households reported problems with medical bills, and then came down to about 43 million. So over the time once the Affordable Care Act went into effect. So that's really good. And then look here at the decline in I can't see where my cursor is, decline in bankruptcies, right? Significant improvement. So we see this really strong association between better healthcare coverage, lower rates of being uninsured, then translates to lower rates of bankruptcies, which makes sense since medical costs were were the major cause of bankruptcy. What about impact on health outcomes, right? So this is trickier because there's so many things that so many determinants of health, and access to medical care is just one of them, right? And the Affordable Care Act mostly dealt with access to medical care, although there's some other things in there too. But so what I'm showing you here in this graph is the rates of pregnancy among adolescents and young women. For the most part, these are people who don't want to be pregnant, okay? And so what you can see is, let me switch colors so I can see what I'm doing. All right. Here is where the Affordable Care Act went into effect. And we see this nice big drop in the numbers of pregnancies in teens and young women. And if you look at a graph of unplanned pregnancies in all age women, you see the same thing. You see the same decline because their insurance now had to cover their birth control, and they couldn't have a huge copay, right? And some types of birth control, for those of you who don't know, can cost $70 a month, right? So this was a real significant barrier for lots of people. And you say, okay, so people are less likely to have an unplanned pregnancy. What else does that translate into? And very interestingly, translates into a much lower rate of abortions. So our abortion rate in this country has been dropping for a long time, but you can see the change in slope that happened after the Affordable Care Act went into play. Now, some other things happened then too. We had increased access to things like the IUD and the implant, which are really highly effective forms of birth control. So it's not just the access to health insurance covering birth control, but it's a lot of it, right? Especially since some of those really effective methods can cost $800. They last for several years, but it's a high upfront cost. Thankfully, with ACA, it's covered. All right. So those are all examples of legislative statutes. So a form of those were all happen to be federal laws, but there are many state statutes or state laws that have to do with healthcare as well. We're going to move next to administrative regulations. So administrative regulations are things that come from the executive branch of government, right? So we've had the Constitution, the founding documents, legislature, executive branch, which at the federal level is going to be the president, so President Joe Biden. At the state level, it's going to be your governor, so Governor Tony Evers. Now, the executive branch is the branch of government that runs the government and make things happen. So it's kind of the operational arm, right? Putting things into practice. How do we actually make these things happen? And so at the federal level, we have all these different departments, right? There's departments of agriculture, commerce, defense, education, Department of Energy, Health and Human Services. We have a whole department. Labor, that's going to be relevant. So we have all these different departments then that deal with how we run the country. Of course, the executive branch at the federal level also oversees the military. It also oversees a lot of other organizations and agencies, some of which fall underneath the headings above and some of which are independent, but I'm not going to quiz you on that. So just a sampling of some of the federal regulatory agencies that are overseen by the executive branch would be the CIA, the IRS, Internal Revenue Service that collects taxes, NOAA, which is the National Oceanic and Atmospheric Association, National Park Service, CDC, Centers for Disease Control, the DEA, Drug Enforcement Agency, EPA, Environmental Protection Agency, EEOC, which is the Equal Employment Opportunity Commission to make sure you don't get discriminated against at work, and OSHA, which is the Occupational Safety and Health Administration. So there are all these different offices that kind of operationalize the laws that Congress passes and figures out how we actually run the business of the country. And so at this level, at the executive, it's rules and regulations. And so these different departments and different organizations can have their own rules and regulations for how things go. So an example of this would be the vaccine mandates. Okay, so everybody's like, oh, Biden's vaccine mandates. Yes, actually, those actually are coming from the executive branch. Those are regulations. Now, there's two of them that are currently making a lot of news, and they are separate because they are coming from these different agencies within the federal government, within the executive branch of the federal government. So one is coming from OSHA. And OSHA's job is to make sure that my workplace is a safe, healthy environment that doesn't put me at undue risk. And so OSHA has said, all right, if you're an employer with 100 or more employees, your employees need to either be vaccinated or wear a mask and get tested once a week. And if an employee takes time off work to get vaccinated, you have to give them paid time off to do that, right? So that's the vaccine mandate for employers with 100 or more employees, and that's coming from OSHA. And if you think about it, it makes sense. So if I'm working on a factory floor, say I'm working in a meat packing plant, we've had tons of COVID outbreaks in meat packing plants because people are yelling because it's loud, there's a lot of moisture in the air, which the viral particles can adhere to, right? It's risky to me to work there, especially if my colleagues aren't wearing masks, right? And even though I can wear a mask, that doesn't protect me nearly as well as if they're wearing a mask and if they are vaccinated. So it improves my health and safety if my coworkers are either vaccinated or masked. Makes sense, right? So this is trying to maintain a safe workplace, right? We have a right to a safe workplace. That's why that rule is put into effect. But of course, people are fighting it, right? Of course. And then the Centers for Medicaid and Medicare Services have said that hospitals and clinics that take funding, so they accept Medicaid or Medicare insurance, healthcare workers who work there must be vaccinated. And so CMS, the Centers for Medicaid and Medicare Services, has a lot of rules and regulations about what it thinks is necessary for a healthcare agency provider to provide appropriate care, right? So standards of kind of quality. And so the argument is it's not a stretch to think if I'm going in to have a surgery done, for me to expect that my surgeon and my nurse and the respiratory therapist are going to be vaccinated because otherwise they're potentially putting me at risk and that I could have a bad health outcome if I get infected by my healthcare provider. So there's all kinds of rules. There's lots of other vaccinations that are required for healthcare workers, hepatitis B, all kinds of things that we have to do. And so this is just yet another one that is intended to protect the safety of the patients. So that's where these mandates come from. Of course, people don't like mandates in general. We tend to be a pretty liberty-focused society. And so a lot of people say, well, this isn't fair. You can't say I have to get vaccinated. And so there have been lots of lawsuits. And in fact, the Supreme Court, it's gone all the way up to the Supreme Court, and they're going to hear arguments this Friday, which will be January 7th. So maybe it's already happened by the time you're watching this video, about whether that is overstepping the authority of OSHA and CMS to require vaccination in those ways. So this is a good segue into the fourth type of law, which is judicial law. So judicial law, judicial judges, right? So this is law that comes from rulings by the courts, okay? And we have it's a complicated diagram here in terms of how our court system works. But in general, if it has to do with a state or local law, it's going to go to some state courts. And then if you're like, I don't like the decision they came to, you can appeal and it'll go to the appeal court. And then if you're like, no, I still don't agree with your decision and I'm going to fight it, it can go up to the state Supreme Court. And then if you're like, I still think you're wrong and this is not right, you can petition to have your case taken up by the Supreme Court. And they may agree to hear your case and say, yeah, I think it has some merit. Let's take a closer look. Or they can deny and they can be like, nah, that's silly. Right? At each of these levels, they can say, no, we refuse to hear that case. It's open and shut. So in Wisconsin, what those state courts look like is kind of off to the left there. But then, of course, there are federal laws, right? So we have state laws and we have federal laws. And so if it's federal law, it's going to go to the U.S. District Courts. If you appeal it, it goes to the U.S. Court of Appeals. And then if you appeal it again, it goes to the Supreme Court. So that's how that all works. And so what the judges are doing is they are interpreting the laws that exist and comparing them to what's outlined in the Constitution, what other laws are there, what other cases have there been, and what precedent has been set by those cases in terms of what previous judges thought was an appropriate interpretation of the law, which is really interesting, this whole idea of precedent. And so based on their decisions, then that results in judicial law, sometimes called case law or common law, right? So it's based on court opinions of judges about what laws can stand and what ones can't. So an example of judicial law is Roe versus Wade. So in 1973, the Supreme Court decided 7-2 that people have a right to have an abortion in the United States. As soon as it's within there's some restrictions on it. It has to be within the has to be like before 24 weeks, and there's a few other things. I can't talk, right? And they cited as rationale for that the 14th Amendment, which is often called the Due Process Clause and the right to privacy. So I've mentioned the 14th Amendment previously, right? Because I said it's the one that talks about life and liberty, right? So basically it says, nor shall any state deprive any person of life, liberty, or property without due process of law, right? It's not that we can't take your life away or take away your freedom. It's just there has to be a good reason for it. There has to be due process of law, right? And it also says you shall not make or enforce any law which shall abridge the privileges or immunities of citizens, right? So it's saying you have a privilege to privacy and autonomy over your own body, and therefore no state can enforce a law that says you can't have an abortion. If you've been paying attention at all, you will know that subsequently several laws have been passed in multiple states, including Texas and some other states, that restrict access to abortion in any of a variety of ways. And those laws are now making it through the courts and will make it up to the Supreme Court, most likely. And so if you've heard people talking about, oh, Roe versus Wade could be overturned, that is true, that could happen, that they could decide, well, actually, no, on further merits, we actually don't think this is true. It'd be highly unusual for them to overturn precedent, extremely unusual, but it's not outside the realm of possibility, certainly given the current makeup of our Supreme Court. And what's interesting for you to know is that Wisconsin actually has a law on the books from 1847, I think, that makes abortion illegal. So if Roe versus Wade gets struck down, then abortion becomes illegal in Wisconsin automatically, because then that law can be enforced. Right now, because of Roe versus Wade, that law is unenforceable, right? Because federal laws override state laws. Haha, interesting. So hopefully this is making sense. Okay. So 4 types of law, right? So founding documents, constitutional law, things that our legislature passes, U.S. Congress or state legislature, administrative regulations from the executive branch, be that the White House and other federal agencies that are underneath that executive branch, or at the state level, we have a whole executive branch at the state level as well. And then judicial law or case law, which is interpretations of laws and policies made by judges that then set a precedent. Okay. So here's the issue, is that just because something is legal doesn't mean that it is right. And just because something is illegal doesn't necessarily mean that it is wrong, right? So is it wrong for people to smoke marijuana? I don't know. Currently, it's illegal in Wisconsin, right? Is it, so there's all these things, right? So, this image says, the Holocaust was legal, right? And hiding Jews from the Nazis was illegal, right? Slavery at the time was legal, and freeing slaves was illegal. Segregation used to be legal and protesting it used to be illegal. So laws can be very, very useful, but you need to remember that they're not the same thing as ethics or morality, right? And so making something legal or illegal is different from saying if something is right or wrong. So now we're going to transition into talking about ethics, okay? So ethics is also called moral philosophy, and it's this discipline within philosophy of kind of looking at what is right, what is wrong, what is good, what is bad. So looking at our principles, our values, what are the things that we hold dear, what are the things that we think make for a good and meaningful life, and then how do we balance competing priorities and competing values, like we've talked about already, right? So the rights of the individual to have control over their own bodies and their own selves, and then the good of the community. So vaccine mandates is a great example of that. So ethics is kind of that discipline of kind of really thinking and examining these things, and being aware of it. Morality is referring more to like, oh, my religion says these things, and so I follow these things. That's what morality tends to be. So sometimes you'll see those words used differently. So in public health, the kind of greater association of public health agencies has set out a whole document about the ethics in public health, which is declaring the values and the standards that are going to be upheld in public health. So these are in the book. I'm just going to quickly run through them because I've been talking a long time. So one is that the principal role of public health is to address causes of disease and requirements for health in order to keep the population healthy, right, and prevent adverse health outcomes. But they still have to respect the rights of the individual. So in American public health, that's number 2, right? So what you'll see sometimes if you're frustrated that maybe your local community didn't require masks and only suggested them or recommended them, that's where this tension comes in. You have to have input from your community members. There's a gazillion of these. You want to lift up the downtrodden and empower the disenfranchised. Seek the information that you need to make good decisions. So all that data collection and analysis that public health agencies do. And then you want to share that information with the communities, right? So that they can be involved in decision making and give consent for any interventions. Again, that consent piece is sometimes tough. Don't dawdle. And then you also need to respect the diverse beliefs and values and cultures within your community. And all of your policies should be implemented in a way that enhance the physical and social environment, right? So you want to be promoting a healthy environment. Confidentiality, we've talked about that before, right? And so public health agencies will not release information about you unless it is absolutely necessary to protect the health of someone else, and they almost never do at all. They need to make sure their workers are competent, and they need to collaborate with other organizations, affiliations, and branches of government in ways that make them more effective and help build trust. Okay. So those are the rules kind of that the professional societies for public health have kind of put forth, as these are going to be their guiding principles. So what we're going to do then is use those guiding principles to help develop health policy. Okay, so what is policy? So policy is rules, regulations, and procedures. So it could be laws, right? And many health policies are codified in laws, especially at the state level. That's where things get really specific. But they might not be laws. They might just be rules or standards within certain groups or businesses, organizations, professional associations, right, have a lot of policies. I, as an instructor, have a policy that if you turn things in late, it starts to get docked points, right? Policy always has an objective or a goal in mind. In that particular example, my goal is to help you stay on track and not fall behind on this course, because you can't do all the units on the last day of the course and do okay, right? So, you have to have a good reason for doing things. Okay, so a policy is just, this is the way we do things, and there's a reason for it that hopefully is justified. So I really like the health in all policy section in the textbook, so definitely give it some time. But it talks about acknowledging that because of all of the determinants of health, right? Remember all of those social determinants of health that we just talked about, that a public health agency alone cannot produce the ideal conditions for optimal health for a community. So you need to partner with all the other aspects of society, right? So they're using this example here of air pollution and how you need to work with the transportation sector, the housing sector, employers. You need to work with all these different agencies, groups, and organizations in order to put in place policies, so rules, regulations, and sometimes laws that then help foster public or population level health. And this is really where the money is, right? So, a public health agency that just handed out masks for dealing with pollution isn't going to be super helpful if your factories keep polluting the air, right? So let's work together to create the optimal environments for health. One of the things the book then talks about, and you'll have some media assignments about, is this question then. So as we think about ethics and we think about rights, many of which are protected by the Constitution, this question of, is healthcare a basic human right? And so in 1948, the then forming UN came up with the Universal Declaration of Human Rights. And according to the Universal Declaration of Human Rights, which many, many countries have signed on to, yes, healthcare is a basic human right. People have a right to receive appropriate medical treatment to improve their life and prevent diseases. But this is not enforceable in the United States. So no international law is, because our federal laws supersede everything, including international law. And so in the United States, we currently do not treat healthcare as a basic human right. This is pretty different from most other industrialized nations where they do. So when we talk about systems of healthcare a little bit later in the course, we'll talk about some of these differences in more detail. But it's important to realize that it's because of these differing philosophies that kind of underlie it, right? So when we think about ethics, it's like our values and our principles. And so when it comes to our philosophies on the role of government in healthcare, again, as Americans, we tend to be pretty hands-off. We don't want our government getting involved in things more than many other nations. Exceptionally so. And so in the book, they talk about two different philosophies. They talk about market justice and they talk about social justice. And so market justice is, this belief that the market is going to take care of society's needs quite well. And this is a philosophy that we have followed to a really large extent in the United States. It's been one of the dominant philosophies that drive a lot of our legislation and other policies. And it views healthcare as like it's an economic good. It's something that you can buy or sell, right? It's a commodity like housing, right? And it assumes that free market conditions for health services, right? So, if you don't like that doctor, go see another one. And if you're a really good doctor, you could charge more money for your services than somebody else who's not. And then it assumes, excuse me, that markets are really efficient at allocating resources equitably. And that was definitely true for a lot of the mid 20th century. The free market did really well in a lot of regards. But as we've kind of released our controls on the free market, we've seen that it's not necessarily in the best interest to allow healthcare to be driven by capitalism. But, that's still kind of how most of it is. So medical care distribution is in part in our country still based on your ability to pay, based on how much you can pay for your health insurance, whether you can afford a premium plan or not, and based on whether you can afford whatever out-of-pocket costs there may be. Also based on, how good of a job do you have and what type of insurance comes with that job. And so we tend to view medical care as an economic reward for personal effort and achievement, right? If you want healthcare, you have to work for it. Whereas the social justice model says this is a social resource, we should allocate it equitably, right? And because we all do better when we all do better. And we're going to be most efficient with allocating those resources if we have some type of centralized planning. And that your ability to receive care should not be related to your ability to pay for it, and sees healthcare as a basic human right. So, of course, you see these things playing out in modern politics all the time, these kind of different philosophies over what's the right approach to healthcare. So again, we'll come back to this a little bit when we talk about our system of healthcare in the United States versus that of other nations. Okay, so we talked about law, ethics, and policy today. So law is these formal codes of behavior. They can be super powerful at improving the health of the population, and they can be constitutional, although there's not really much at the constitutional level, legislative statutes, executive regulations, administrative regulations, and judicial or case law. Ethics is how we decide what's good, bad, and right and wrong, and it's going to differ depending on your personal philosophies, beliefs, and values. And that's where things get really tricky, because then when we're trying to decide policy, so how do we put our ethics into practice? What decisions do we make about how we want our world to work? Then it's tough because we don't all hold the same values and philosophies. So that's why this is so interesting and so difficult, especially in such a large country with such a diverse population. All right, everyone, that's it for Unit 5. I hope you enjoyed the immediate assignments and the activity, which is going to be a scavenger hunt of sorts. All right, everybody. Bye-bye.